here in London. Claire and I are just going to do a few minutes of key updates from the department, and I will say something about the SEND review, which I know you're all straining at the leash to hear about and even more to see. So we'll cover that off in a second. Next slide. So the areas. Yeah, all right, next slide. So these are the areas we're just going to do a bit on. Claire's going to do a little bit on strategic participation and SENDIAS. I'll say a bit about a massive survey from the Children's Commissioner and about the behaviour and exclusions guidance, and then a little bit about the SEND review. So next slide, over to my colleague Claire.
Thanks, Andre. Hi, everyone. Lovely to see you all. I'm Claire Hughes. I'm the Dispute Resolution Policy Lead in the department. I'm just going to give you a very short update on some of the department's support in this space and to confirm that department's going to be continuing to support both financially and with development training, etc., parent carer forums and young people's local participation groups in future years. There have been some really great examples of local areas working in co-production with parent carers and young people to design services which meet the needs of families and prevent issues later down the line. And we know that engagement with families at an individual level is also a really helpful way of resolving disputes early. And then also support for SEND information advice and support services is also continuing at a national level in future years. I think I saw someone from SENDIAS on the call actually, which is great. And I know from my own experience of speaking to local areas and from going out to visit SENDIAS themselves that they play a really critical role in de-escalating disputes locally and supporting informal mediation. So just a couple of very high level updates for you there. I'll hand back over to Andre.
Thanks, Claire. And I'll just add on SENDIAS. It is a service that consistently comes up well in local area inspections by Ofsted and CQC, and really emphasises the value that parents and young people place on that service. Okay, next slide. About 6 months ago, the new Children's Commissioner, who was new at the time, put out a large survey to children and young people in England, and it was enormous. It took in all sorts of issues, including those who identified themselves with a special educational need. And actually, there's some of the conclusions which I think are really important. They reinforce the direction we've tried to go in with policy for the last few years, that what we want to do for children with special educational needs is no different to what we want to do with all children. And that was emphasised when we actually asked children and young people about their world views. And really, there were no statistical differences in terms of their levels of happiness, what they saw as important factors for their future, and their own worries about the future. They also had little difference in the groups of children with SEN and those without in terms of their perceptions of life compared to that of their parents. Children with special needs placed high importance on a good job or career, in getting enough money to buy the things they need, and a good education in the future. Or very strongly reinforcing the preparation for adulthood agenda that we've been really strongly promoting and working towards since 2014. Next slide. What were the aspects of life that they were most unhappy with? Number one was their mental health. And these questions obviously were asked at the height of the pandemic. We've had consistent research over the last 15 months about the impact of the pandemic on children and young people's mental health. And that was certainly reinforced by this survey, which was asking children themselves. So that was the number one aspect. And those of you here today, and I can see a lot of you with a degree of influence and commissioning powers in relation to local mental health services, it really highlights the importance of improving that service. There were also issues around the choice of things to do in their local area, and children with disabilities in particular found that there were limited options for them in terms of facilities and access, and particularly transport. but they were also unhappy with life at school. As we know, don't we, that children with SEN are more likely to be bullied at school. If you're bullied at school, you're going to be unhappy at school. And some of the academic demands were excessive. They wanted teachers to have more training to equip them with learning materials and teaching approaches that would work for them. So upskilling the workforce. And they also wanted easier routes to diagnosis within school, easier access to treatment, and more awareness within school of different types of SEND. And I think that plays into one of the things that has been heralded about the review, that it is looking at how to support the mainstream sector more clearly. I saw Pat's question, diagnosis or assessment. Diagnosis was the word used in the survey, so that's what came back. So again, I think it is really important to take account of these surveys because they should be feeding into our priorities and what we're aiming to do for the population for whom we have responsibility. Next slide. There are currently two significant consultations out at the moment, and these are ones that I think should be of interest to everyone here today. One is about the behaviour in schools guidance, and one is about exclusion guidance. So there are revisions to both of those, and we're looking for feedback by the 31st of March. So there's still time to access those. I'm assuming, Emma, that these slides will go out and therefore the links that I've provided will work for everyone. So do please have a look at that and see whether you feel, particularly I think in the behaviour guidance, whether we've got the tone right, the messaging to schools right, and do feedback on that. Next slide takes us into the review. So Emma, there's a question, can the links be put into the chat? Can I leave that with you and your colleagues?
No
the
problem.
key objectives of the SEND review. It's been a long time coming, undoubtedly. The key objectives are to ensure that children get the right support at the right time and that it's in the right place. There's a very strong issue when you analyse all the issues in the system. There is a very significant local variation. A local variation on almost any indice you take of SEN. The proportion of children with EHC plans varies significantly from one local area to another. The level identified at SEN support varies significantly from one school to another. And we know from research that that's got nothing to do with the school characteristics or the child characteristics. There's a whole complex range that interact. Take tribunals, for example. There are some local areas with very, very few appeals to the tribunal. There are some who have very many appeals to the tribunal. Local variation. The experience of children and families differs from one place to another. And the review is looking to see how we can get that balance much better. A strong focus on clarifying accountabilities at every level of the system, and that is certainly one of the issues that's heralded in every quarter, that the accountabilities don't always align with what people are asked to do, and actually where does the power lie to get something done and therefore take responsibility for that. So looking at accountabilities is something else the review look at. Improved outcomes for children and young people. Outcomes are not good enough at the moment, despite huge increases in funding. They're not matched by the same level of increased outcomes. What can we do about that? So we need to have improved confidence in a financially sustainable system. To test, we also want to realise the benefits of the aligned education, health and care provision and prepare children and young people for a happy and rewarding adult life, as was called for by those responses from the Children's Commissioner's survey. But those benefits of the aligned health and care provision, the vision of 2014 of a much more joined up service from health and social care has not yet been fully realised. And the review is looking how to take that on another step. Next slide. So the review is moving forward. It's had a steering group, and the bottom of this slide, if you want to click on that word group, you will find membership of that steering group. The aim is to publish proposals in the first quarter of 2022, and we're on track to do that. It will lead to it will be in the form of a green paper. It will have consultation questions. There will be a period of time for feedback to the script in the review and to those questions. Okay, I think that's my last slide. Emma, is there time for 2 or 3 questions?
Yep, you've definitely got time. We've got one from Tracy asking, is anyone analysing the variations? And they may be influenced by factors other than just service delivery.
People are always analysing the variations, Tracy, and you're right, they're influenced by much more than factors other than just service delivery. There's a whole complex range of issues that explain variation, but they don't necessarily justify it. And I think that's where we've got to get to. We've got to get to a stronger point of saying these are acceptable variations. In some instances, they don't appear to be. So the review might have more to say on that.
Thanks, Andre. We have a question from Pat Bullen. Date if review sorry, Pat, do you want to talk to that? Related to
date of, I think it's just a typo. Yeah, date of review publication, has it possibly slipped beyond the date advised by Minister Quince to NNPCF?
We have said that the review will be published in the first quarter of 2022, and it's on track to do so.
Thanks, Andre. And Leslie asked whether NHS are involved in the reviews.
In the SEND review, yes, of course. We've had lots of discussions with NHS England, DHSC, and other government departments, and are represented on the steering group. Oh yes, there you are. Yes, Sue North is one representative, and DHSC is also on it.
And I've got a question from Carol Ann. You might need to expand on this, Carol. Asked, is there different groups of parents? Is it that different groups of parents either appeal or don't appeal, have the internal or financial resources to appeal? So I suppose that's asking again around the connection to areas and tribunal rates.
That's a question that we certainly haven't analysed. We've got data on the types of need of children that appeal. We've obviously got data on the ages of appeals, the reasons for appeal, but I think that would be an extremely difficult question to get underneath.
I think it'd be a really difficult question, but I think the assumption that it's perhaps differences in services or other factors that are affecting appeal rates is quite a jump. We're a very large county and we see an absolute spike. So we have consistent services across the county, but we see an absolute spike in appeals in our most affluent area. And that's quite marked to us. And I just wondered whether the review was analysing those factors as well, because I think it's quite a conclusion that the differences in appeal rates across the country are due to differences in services.
I don't think we would say that they're due to differences in services. That would be one.
Sorry,
factor.
I thought I had that.
But we don't have that data. If you've got it, then I think it's a message for you about how you analyse and work in your local area. It's possible that Judge Jane McConnell might have some views about the type of appeals that they're getting and the sort of the demands on families as a result. So, but I don't think we've got any further breakdown of that. There's certainly plenty of, I mean, again, if you look at the type of areas, there are some areas that are so-called affluent that have very low levels of appeal.
Fantastic. Thanks, Andre. That's all the questions we had. There are a few questions that are relating to the national trial. We do have, our next speaker is Jane, so we'll be picking up, you'll both hear extra information from Jane. But thank you so much, Andre and Claire, for your time today.